I'm Dr. Fred Bauman. I've been a neurologist and child neurologist for 35 years. Neurologists determine whether or not patients have diseases of the brain and nervous system.
From 1990 to the present time, researchers, mainly at the National Institute of Mental Health, have done brain scans on children with ADHD and have compared them to normal control groups. And this research has shown, on average, 10% brain atrophy or brain shrinkage. In all instances, the researchers have concluded and have stated in their conclusions and in abstracts and in press releases that ADHD was the cause of the brain atrophy, making ADHD an actual brain disease. What they neglected to tell the public was that virtually all of the ADHD subject groups had been on long-term stimulant therapy, and that the stimulants themselves, the Ritalin and amphetamines, were the likely cause of the brain atrophy. And so at no time has the scientific literature proven that ADHD is an actual disease, and at no time have they disproven that the drugs used to treat ADHD are themselves the cause of the brain atrophy.
I've never agreed with psychiatry, ever. Before I was a Scientologist, I never agreed with psychiatry. And then when I started studying the history of psychiatry, I started realizing more and more why I didn't agree with psychiatry. And as far as the Brooke Shields thing is, look, you gotta understand, I really care about Brooke Shields. I think here's a wonderful and talented woman. And I want to see her do well. And I know that psychiatry is a pseudoscience.
But Tom, if she said that this particular thing helped her feel better, whether it was the antidepressant or going to a counselor or a psychiatrist, isn't that enough?
Matt, you have to understand this. Here we are today, where I talk out against drugs and psychiatric abuses of electric shocking people, okay, against their will, of drugging children with them not knowing the effects of these drugs. Do you know what Adderall is? Do you know Ritalin? Do you know now that Ritalin is a street drug? Do you understand that?
The difference is this was not against her will, though. But this wasn't against Brooke's will.
Matt, I'm asking you a question.
I understand there's abuse of all of these things.
No, you see, here's the problem. You don't know the history of psychiatry. I do.
Aren't there examples, and might not Brooke Shields be an example of someone who benefited from one of those drugs?
All it does is mask the problem, Matt. And if you understand the history of it, it masks the problem. That's what it does. That's all it does.